So the clinical trial that we've just presented at the meeting was the first trial of a targeted therapy in kids with a specific mutation. In fact, a mutation originally identified in adults with malignant melanoma called the BRAF V600E. And we had discovered a number of years ago that there are some pediatric tumors that actually share the same mutation. And the question was, does the drug that works in adult, would it work in the same tumors in pediatrics? The trial was somewhat unusual because instead of being a trial just for kids with a particular type of brain tumor, the trial was for actually all pediatric patients that had that mutation, because we've discovered that mutation in a number of different pediatric tumors, both of the body as well as of the brain. So we first began by identifying what the appropriate dose in children was, and it turned out to be very similar to adults, although there are some slight variations. And then once we had done that, we took a large cohort of children with each of the different diseases, malignant gliomas, low-grade gliomas, histiocytosis, thyroid carcinoma, et cetera, the tumors in pediatrics that have the mutation, and we treated them with this particular drug so that we could now determine the dose, the toxicity, and the efficacy, and that was the goal of the study. We were really excited to see the results of the trial for a number of reasons. First of all, it turned out that the drug is very well tolerated. In fact, we had somewhat less toxicity in kids than we did in adults. One of the side effects of this drug is this particular type induction of a disease called squamous cell carcinoma, a disease of the skin that's often associated with a lot of sun exposure. Of course, one of the good things about kids is that they really haven't had enough sun exposure, certainly not compared to 50, 60, and 70-year-old adults. So a toxicity that was quite common in the adults, we didn't see at all in the kids. I suspect with tanning booths and stuff, it's only a matter of time before we see one, but certainly it tells us that it's not going to be the same kind of issue it was in adult. Not only was the drug incredibly well tolerated, the exciting part, of course, was that it actually significantly reduced either the size or growth of the tumors in kids along a variety of different subtypes. The particular presentation was on the most common brain tumor in children called pediatric low-grade gliomas, where this mutation is frequently seen. And in that circumstance, over 80% of all of the tumors either disappeared, shrunk, or stopped growing completely.